Ready to dig in. Today, we're all about the link between diabetes and oral health. And trust me, it's a lot more connected than you might think.
It really is.
If you're the type who loves those, whoa, didn't know that moments,
Yeah,
you are in the right spot.
absolutely.
And let's face it, this is something that touches a whole lot of us. We're talking over 30 million Americans dealing with diabetes. That's a lot of people.
It is. It's actually almost like saying the entire state of California has diabetes, which is pretty mind-blowing when you think about it. And, it just goes to show why getting this whole connection between diabetes and specifically how it affects your oral health, why that's so important for everyone to understand. Because diabetes, at its core, it's your body having trouble managing your blood sugar. And trust me, that impacts your whole body, not just one part.
Okay, so let's break this down a bit.
Yeah.
From what we've been reading, it's pretty clear. Diabetes can really mess with your oral health, and not in a good way.
Right.
We're talking about a higher chance of getting everything from those early signs of gum issues, gingivitis,
Yeah.
to full-blown periodontal disease.
Hmm.
And then there's cavities, dry mouth, even oral thrush, which, let's be honest, nobody wants to hear at the dentist, right?
Definitely not.
It's not exactly a walk in the park. So what's the deal here? Why does diabetes seem to have this direct line to messing with our mouths?
Well, it all boils down to those high blood sugar levels we were talking about. Think of it this way. All that extra sugar in your system, it's like setting out an all-you-can-eat buffet for all the bad bacteria living in your mouth. And trust me, they are going to feast.
So instead of a nice balanced environment in there, it's more like a bacterial party.
Mm.
And guess who's supplying all the snacks?
Exactly. High blood sugar. And as you can imagine, all that partying leads to trouble. You see, your gums are like the foundation for your teeth, right?
Right.
So with periodontal disease, those gums start to pull away from your teeth, and that creates these little pockets where bacteria can just hang out and cause all sorts of problems. And we're not just talking about inflammation or even infection, although those are bad enough. In some cases, it can even lead to bone loss. It's serious stuff.
Wow. Okay, so we're not messing around here. You mentioned that 22% of people with diabetes end up with periodontal disease, and that's a pretty scary statistic.
It is. It's a big deal. And what's even more, well, I'd say a bit concerning, is that this whole diabetes and oral health thing, it's not a one-way street. It's like this having advanced gum disease, it doesn't just happen because of diabetes. It can actually make it harder to keep your blood sugar under control.
Wait, so you're saying it creates a kind of cycle? Diabetes can make gum disease worse, but then having bad gums makes it harder to manage the diabetes itself.
Exactly. It's a two-way street. And that's why getting a handle on this whole connection is so important. It's not just about your mouth, it's about your whole body. Basically, when those gums get really inflamed, it doesn't stay put, it actually affects your whole body. And that makes it tougher for your body to use insulin the way it should.
And insulin is what keeps those blood sugar levels in check.
Exactly.
Okay, so we need to be clear here. This isn't just about a little bleeding when you brush. This is about a chain reaction happening inside your body because of this one thing.
That's it. It's like a domino effect. Taking care of your mouth, it's not just about a pretty smile anymore. It's a key part of keeping your diabetes in check.
All right, so this is definitely eye-opening. But knowing all this, what can people actually do? I mean, it can get overwhelming hearing about all these risks and connections. How do we go from what's the problem to what do I do about it? Especially for those listening who are already living with diabetes.
I'm so glad you asked that. Because the good news is, once you know this stuff, you can take charge. And the best part is, a lot of it boils down to being on top of your game with your oral health routine. It's not some big, complicated medical thing. It's about the little habits.
So, kind of like putting money in your savings every month, a little consistency goes a long way.
Precisely. First things first. Those regular dental checkups. Those are non-negotiables, at least twice a year. And it's not just about getting a cleaning. It's about having an expert who knows what to look for, so if there's any sign of gum disease or problems, they can catch it early on.
Makes sense. Prevention is always easier than trying to fix it later.
Oh, absolutely.
Okay, but what about between those visits? What can people do at home every day that actually makes a difference?
It's funny. It's those basics, those things we all know we should do, but they become even more important when you have diabetes. Brushing twice a day with a fluoride toothpaste, that's key.
Yeah.
And don't just rush through it. Take your time, use a soft brush, and really get all those surfaces.
And we can't forget flossing. I'll admit, sometimes I get a little lazy with that one.
I hear ya. But it's crucial. It's like giving your gums an assist. Flossing gets rid of all that gunk between your teeth, the stuff your toothbrush can't reach. and that stops the bad bacteria from setting up shop.
It's funny how we can think about our mouths like they're totally separate from the rest of our body. But what we've learned today just proves that everything is connected. And that's even more true when we're talking about diabetes.
That's right. And don't underestimate the power of a good mouthwash. Adding a therapeutic mouthwash to your routine can really boost your oral health.
Oh yeah, mouthwash. I was just thinking about that.
It helps keep those bacteria levels down, fights plaque, and gets into those nooks and crannies, even places you might miss with floss. Think of it like backup for your gums.
Okay, I like that. Extra defense. So, with all this talk about brushing, flossing, and now mouthwash, what's the main message we want to send to our listeners today, especially those who are living with diabetes? What should they really be taking away from this?
That's a great question, and it really gets to the heart of things. Taking care of your oral health, it's not just about avoiding a few cavities or having a sparkly smile, although those are nice perks. It's about recognizing that it's a crucial part of managing diabetes and taking care of your whole self.
So more than just a chore, it's a way to take control of your health.
Exactly. And the best part, you have the power to do it. Those small changes you stick with every day, those are what make a difference. It's not just about your mouth, it's about your overall health. And that's especially true when you're living with diabetes.
I love that it really shows how much control we have. Well, as we start to wrap up today's deep dive, is there one big takeaway you want to leave with our listeners?
Absolutely. It's simple. Taking care of your oral health is a way of taking care of your entire well-being, especially for those of you managing diabetes. It matters.
You said it. Now, here's something to think about as you go about your day. And no more dental puns, I promise. Take a look at your own routine. Are you brushing, flossing, and using mouthwash regularly? Are you doing the things we talked about today? Because it's never too late to start prioritizing your oral health.
Well said. And this whole conversation, it really makes you think. We've been talking about diabetes and oral health, but this research, it also mentioned that diabetes was the seventh leading cause of death back in 2015, and heart disease was number one. It makes you wonder if there's a connection there, too.
Now that is definitely a deep dive for another day. Until then, stay curious, keep learning, and take care of those smiles.